So I would like to invite you to join us on Saturday and Sunday. We will have 24 cases, 12 for each day, with very interesting cases, therapeutic cases by EOS, therapeutic cases by uh, um, ERCP and cholangioscopy, new technologies. We will launch the new uh, echoendoscope from Endosound that is adaptable endoscopic ultrasound machine to any kind of standard scope. So it's very interesting the technology that we will show you during the live transmission during these days with um, great quality of international faculties. So please don't forget to join us. I would like to show you a little bit. Um, um, I start up. What do you will see during these days? So today we have a very interesting case. This is um, male with 49 years old that come to our unit because jaundice and weight loss, 5 kilograms more or less during the last weeks. So what we see today during the evaluation of US is that this patient have a pancreatic mass, a solid pancreatic mass in the head of the pancreas. So the lesion is here. You can see here. I want to show you where is coming the lesion. So the lesion is here. It's in around 20 millimeter of diameter by 16. So this is the lesion, but this lesion is coming from the uncinate process. I will show you in a few minutes. So what we have here. So until now, we have a lot of technologies that we can use to measure this lesion. So we have elastography, as you remember, has been used during a longer period of time. And so this elastography, we can have qualitative and quantitative metrics. So I will perform strain radio evaluation of the lesion. So it have a blue area, so hard tissue, and we can compare with the standard tissue. I always use the mucosa to have the result. So the strain radio difference between the A circle, that is the mass, and the red circle, that is a soft tissue. So the ratio is 8.57. So I don't see, at least by these metrics, I don't see, uh, a very hard tissue. So until now, so this is undifferentiated to me. This is a irregular mass, hypoechogenic, some areas of isoechogenic areas. But we have also strain histogram, and the strain histogram we have a mean of 48. It means it's a hard tissue. Normally it's over more than 100, the mean strain histogram, but the mean here is 48, so less than 50 is suspected for malignancy also. So this patient have serum tumor markers normal, so but have this lesion. So to me, this because of the age, because of the weight loss, and or the clinical aspect could be a pancreatic mass. It means a malignancy here in the pancreas, but we need to evaluate. We need to have tissue. We need to evaluate with the technologies also. So I have doubts. I am not sure with this. Okay. So we have also as a metric. We have also today the share wave. So we can measure um, the elasticity of the tissue also, but not by software, but also using this software. But this is a more objective way to measure the lesion. So I start to have the measure. So the elasticity you can see here is 13. So more than 5 normal tissue is until 4 or 3, and more than 5 is suspected for, for inflammatory chronic lesion, but more than 10 is for sure probably malignancy. So we have two measures, and the second measure is 32. It means this is a hard tissue. This is not this is not so what we do with this technology is to have 10 measures, even in the same way that we do for using FibroScan for hepatic disease. So we have 10 measures, and then we have a mean of these 10 measures as per protocol developed in our institution. So to have the mean of elasticity of the tissue, and we have 9 measures here. And now I will do the last one, and you see it's just pushing a button, okay? So the elasticity of is a hard tissue is 21, so it means this is really hard tissue. And nowadays we have also a new kind of technology that we will show during our ¿Cómo puedo ver las otras imágenes? Aquí, ¿no? In our Arieta 850. It's a new kind of technology that can let us to measure the flow of the lesion. So I can show you a little bit what we can see here. This is so this is image that I take it from the kidney. So you can see the microvascularization without using contrast. So now we can evaluate also with this technology. And what I want to show you is the DFI technology. So we have two ways of to evaluate this technology. So I will use the dual CF to see. So what we see here is the microvascularization. So you can see some vessels here. So these vessels are going around the lesion. I don't know if we see very well. I will try to show a little bit. So you see here, so this is the mass, and this is the mass here, you see? So this lesion doesn't have hypervascularization. This is hypovascularity. So this is around the lesion. So this lesion doesn't have any vascularization. With this technology, we can see also a little bit in 3D image. Very interesting how we can see, and we can avoid to use with this technology. We can see the vessels here, but these vessels are around the lesion. You can see here. So this is probably, as I have all the measures, all the parameters, to my opinion, this is probably a pancreatic adenocarcinoma. So I would like to show you a little bit the technology and the quality of what we are looking here. So this is microvascularization. This is not, cannot be looked normally by, by the e-flow or the Doppler. As you can see here, for example, I will show you some image that I take it. This is you see from the same region. You see here the splenic vein, and when we see here, we see much vessels. Let me see what is the better image. This is a good image from the same region, and you can see here, you know, the microvascularization. So this is very interesting technology that we can use now. So I will use contrast now. I would like to show you how DFI is very similar to contrast, and so now we are preparing the contrast. We can see here the lesion very well. So you have the black and white image and the contrast image. So we will see how the contrast can be measured using this old new technology. So, ¿podemos usar el contraste, por favor? So now we pass the contrast. We can see here the lesion very well, and we will see if this is hypovascularization lesion. So we have 23 seconds, so the contrast is arriving. You see here the contrast is arriving. It's very similar what we see with DFI. You see, there is no captation, there is no contrast captation, and this is very interesting because it's similar image, but we don't need to use the contrast. You see, very well, huh? So you see very well, it's very nice. So no contrast captation, and some vessels in the in the peripheric area of the lesion. So I confirm the same result from DFI. So now is the future, and probably with the results of new studies, we will stop to use contrast and start to use DFI. Very interesting. Okay, so now I will show you the image of DFI, and I will show you the image of contrast. Okay, so now so you can see the image in the peripheric area. This is a video. Huh? So and the contrast having the same result. So this is very interesting. And I will do DFI now. You see the vessels. We can see in two ways. So normal view, you see here. So no contrast captation. It's the same captation of the contrast. You see, just peripheric vessels. This one here, you see, this one, and this one. we saw during the contrast captation, but not contrast captation inside the tumor. So to me, this is probably pancreatic adenocarcinoma. So now I will use a needle to have a histology of this lesion. And I would like to say thank you to join us today. Please don't miss our live endoscopy course this weekend. So with a very nice group of international faculties showing the new technologies, I would like to say thank you to Pentax Medica and Microtech of our bigger sponsors for this course. Then we have Equasurgical, Perfect Edge, Fujifilm, Medicamenta Ecuatoriana, Creo Medical, Taiwan, and Gastritech. Thank you for be part of this live endoscopy online course. Also to Irby, Medicorsa, Cook Medical, Travapic, Boreal, Abbott to stay with us. So thank you so much. I will close my live transmission. I will do a final biopsy of FMB, but please join us and see very interesting cases, ESD, and new technologies and new materials that we will show during the all live endoscopy transmission. Also, AI technology in US and cholangioscopy. Please don't miss this very interesting live endoscopy course. So thank you, and we cut the transmission. We see you on Saturday. We start 8:30 Ecuadorian time.